Full bladder, full life. Unveiling the secrets of the bladder meridian. Introduction to Traditional Chinese Medicine (TCM). Traditional Chinese Medicine (TCM) is a holistic medical system that has been used in China for thousands of years. It is based on a comprehensive understanding of health and illness and sees people as an interplay of body, mind and environment. The history of TCM goes back far into China's past. Its origins lie in ancient writings and traditions that have been developed and refined over centuries. Various traditions and influences have been interwoven to form the current understanding and practice of TCM. A central aspect of TCM philosophy is the principle of yin and yang, which describes the polarity and balance in nature and in the human body. Yin stands for the feminine, dark and cool, while yang represents the masculine, light and warm. The five elements, also called phases of change, wood, fire, earth, metal, water, are another fundamental concept in TCM and describe the dynamic interrelationships in nature and in the body. Diagnosis and analysis in TCM is carried out by taking a comprehensive look at the patient. The therapist conducts a detailed analysis and interviews in order to understand the individual's living conditions, complaints and medical history. In addition, the patient's tongue, pulse and face are observed in order to obtain information about the condition of the organs and meridians. Using so-called pattern recognition, the collected information is classified into syndromes and the treatment strategy is determined. In TCM, the organs are not only considered anatomical units, but they also have an energetic significance. There are 5 Zhang organs, also called yin organs: liver, heart, spleen, lungs, kidneys, and 6 Fu organs, also called yang organs: gallbladder, small intestine, stomach, large intestine, bladder, triple warmer. The meridians are energy channels in the body that connect the organs and enable the flow of qi, the life energy. TCM offers various treatment methods to restore energetic balance and promote health. These include acupuncture and moxibustion, which stimulate specific points on the meridians. Herbal medicine, nutritional therapy, Tuina massage and qigong also play an important role. TCM has evolved and modernized over time while maintaining its cultural identity. Today, it is gaining more and more importance internationally and is valued by many people as an alternative or complementary treatment method. However, the integration of TCM into modern medicine and its scientific research also present challenges that must be overcome. Overall, TCM is a fascinating medical system that focuses not only on physical health, but also on emotional and spiritual well-being. With its holistic approach and emphasis on prevention and health promotion, TCM makes a unique contribution to global healthcare. Basics of TCM. The principles of traditional Chinese medicine (TCM) form the foundation of this holistic medical system. TCM is closely interwoven with Chinese culture, philosophy and worldview and is based on a few central concepts. Yin and yang. The principle of polarity. Yin and yang are two opposing but complementary forces that exist in everything. Yin represents the feminine, dark, cool and yielding, while yang represents the masculine, light, warm and active. Yin and yang are not static, but are in constant motion and change. Their balance is crucial for human health and well-being. The 5 elements. Phases of change. The 5 elements, wood, fire, earth, metal and water, are another important concept in TCM. They represent the fundamental forces in nature and in the human body. Each element is associated with certain organs, emotions and characteristics. Understanding the relationships between the elements enables deeper diagnosis and therapy in TCM. Ki. Life energy. Ki is a central energy force in TCM that flows through all living things. It is considered the vital life energy that animates the body and mind. The presence of sufficient and harmonious Ki is crucial for health and well-being, while blockages or disharmony can lead to illness. The meridians and the flow of energy. The meridians are energy channels in the body through which Ki flows. There are 12 main meridians, each of which is connected to one of the 5 elements and the Zhang Fu organs. The acupuncture points along the meridians can be stimulated to regulate the flow of energy and improve health. Holistic view of the human being in TCM. The human being is seen as a holistic being in which body, mind and soul are inseparably connected. Health is the result of a harmonious balance between yin and yang, Ki flow and the 5 elements. Illness is understood as an imbalance or disturbance in these energy flows. Diagnostic methods. TCM uses various diagnostic methods to assess the patient's health. These include analysis and questioning, observation of the tongue and pulse, and pattern recognition. The diagnosis in TCM includes not only the symptoms, but also the underlying causes and individual circumstances of the patient. The fundamentals of TCM form the basis for its diagnostic and treatment principles. The holistic understanding of health and illness, the interplay of yin and yang, the importance of Ki and the role of meridians make TCM a unique medical system that offers an alternative perspective on human health. The importance of meridians in TCM. The meridians play a central role in traditional Chinese medicine TCM, and are a fundamental concept for understanding the energetic structure of the body. They represent the energy channels through which Ki, life energy, circulates in the body. The importance of the meridians in TCM can be summarized as follows. Energy flow and health. In TCM it is believed that a person's health depends on an unhindered flow of Ki in the meridians. When the Ki flows freely and harmoniously, the body is well supplied with energy and the person is in a state of well-being and health. Blockages or stagnations in the energy flow, on the other hand, can lead to illness and complaints. Connection to organs. Each main meridian is associated with a specific organ, which is classified as a Zhang organ, Yin organ, or a Fu organ, Yang organ. This connection means that the state of the meridian and the energy flowing through it can also affect the functions and well-being of the corresponding organ. Therefore, examining and treating the meridians can provide information about the health of the organs. Acupuncture and acupressure. The meridians are the basis for the practices of acupuncture and acupressure in TCM. Along the meridians are specific acupuncture points that can be stimulated by needles or manual pressure to regulate the flow of energy and restore energetic balance in the body. These treatment methods are widely used in TCM and can be used for a variety of ailments. Interaction with yin and yang. The meridians are also linked to the concepts of yin and yang in TCM. Each main meridian is classified as a yin or yang meridian, and their interaction affects the overall balance of yin and yang in the body. A harmonious balance between the meridians that takes both aspects into account is important for human health. Diagnosis and treatment. Examining the meridians and assessing their condition are important steps in diagnosing diseases in TCM. By observing the flow of energy and identifying blockages or imbalances, Therapists can develop the appropriate treatment strategy to restore energetic balance and promote health. The meridians are a fascinating and complex concept in TCM. Understanding them makes it possible to understand the energy processes in the body and to better diagnose and treat individual health conditions. The importance of the meridians in TCM underlines the holistic view of body and mind and offers an alternative approach to human health and well-being. Overview of the bladder meridian. The bladder meridian is one of the most important main meridians in traditional Chinese medicine TCM. It runs along the back of the body and plays an important role in energy flow and well-being. An overview of the bladder meridian includes the following aspects. Anatomy and course. The bladder meridian begins at the inner corner of the eye and runs over the head along the middle of the back down to the sole of the foot. It passes through the neck, back, buttocks, the back of the thighs and calves, and the sole of the foot. It is the longest meridian in the body and has a total of 67 acupuncture points. Energy flow and function. The bladder meridian regulates the flow of qi, vital energy, along its course. It has a close connection to the kidney meridian as both meridians work together in terms of yin and yang. The bladder meridian supports the function of the bladder, kidneys and spinal cord. Its job is to store qi and release it when needed to maintain the overall energy balance in the body. Common disorders and symptoms. Blockages or stagnations in the bladder meridian can lead to various complaints, such as back pain, sciatica, stiff neck, headaches, lower back pain, bladder infections and urinary tract problems. Emotional aspects, such as anxiety or nervousness, can also be associated with an imbalance in the bladder meridian. Diagnosis and treatment. Bladder meridian disorders are diagnosed by observing symptoms, examining energy flow and palpating acupuncture points. Treatment involves acupuncture, moxibustion, acupressure, herbal medicine and other TCM techniques to regulate the energy flow in the meridian and restore balance. Prevention and health maintenance. To prevent disorders in the bladder meridian, it is important to maintain a healthy lifestyle, reduce stress, get enough sleep and eat a balanced diet. Regular exercise, such as Qigong or Tai Chi, can also help promote the flow of energy in the bladder meridian and support health. The bladder meridian plays an important role in TCM and is closely linked to the health of the body and mind. A harmonious flow of energy in the bladder meridian contributes to general well-being and supports the energy balance in the entire body. A holistic view and care of the bladder meridian are therefore crucial for good health and quality of life. Anatomy and course of the bladder meridian. The bladder meridian is one of the most important main meridians in traditional Chinese medicine TCM. Its course and anatomy extend across the entire body, running along the back. Starting at the inner corner of the eye, the bladder meridian runs over the head down along the spine, over the neck and back, down to the heels and soles of the feet. The bladder meridian runs through the neck, back, buttocks, back of the thighs and calves, and ends at the little toes and the outside of the sole of the foot. In total, the bladder meridian has 67 acupuncture points along its course. The task of the bladder meridian is to regulate and control the flow of qi, vital energy, in the body. It works closely with the kidney meridian to maintain the overall energetic balance in the body. The bladder meridian supports the function of the bladder, kidneys and spinal cord. Disturbances or blockages in the bladder meridian can lead to various complaints. These include back pain, sciatica, stiff neck, headaches and lower back pain. Diseases related to the bladder and urinary tract can also indicate an imbalance in the bladder meridian. Disorders of the bladder meridian are diagnosed by observing symptoms, examining the flow of energy and palpating acupuncture points. Various TCM techniques are used for treatment, including acupuncture, moxibustion, acupressure and herbal medicine. The aim is to regulate the flow of energy in the meridian and restore the energetic balance in the body. To keep the bladder meridian healthy, it is important to maintain a balanced lifestyle, reduce stress and ensure adequate sleep. Regular exercise, such as Qigong or Tai Chi, can help promote the flow of energy in the bladder meridian and support health. Overall, the bladder meridian plays a crucial role in TCM and is closely linked to the health of the entire body and mind. A harmonious flow of energy in this meridian is important for general well-being and helps maintain a healthy energy balance in the body. Description of the bladder meridian. The bladder meridian is one of the most important main meridians in traditional Chinese medicine TCM, and is one of the yin meridians. It runs along the back of the body and is closely linked to the function of the bladder and kidneys. The bladder meridian is part of a comprehensive energetic system in the body that regulates the flow of qi, vital energy, and maintains the balance between yin and yang. In TCM, the bladder meridian is classified as a yin meridian because it is related to the zhang organs, yin organs, especially the kidney. In TCM, the kidney is considered a central organ for maintaining the vitality, life fire and basic energy of the body. The bladder meridian is therefore closely connected to the kidney energy and supports its functions. The bladder meridian begins at the inner eyebrow and runs over the head, neck, back and buttocks down to the heels and soles of the feet. In total, it has 67 acupuncture points distributed along its course. Each of these points has a specific function and can be used to regulate the flow of energy in the meridian. Course of the bladder meridian in the body. The bladder meridian begins at the inner corner of the eye and runs over the forehead and head down to the back of the head. From there it runs along the spine over the neck, back and buttocks down to the heels and soles of the feet. There are several important acupuncture points along its course that are used by TCM practitioners to regulate the flow of energy in the bladder meridian and restore energetic balance in the body. These points are treated with needling or acupressure to release blockages or stagnations in the meridian and allow the qi to flow freely again. Since the bladder meridian runs along the back of the body, it is particularly important for supporting the back and neck muscles. Blockages or disharmonies in the bladder meridian can lead to complaints such as back pain, stiff neck and headaches. The course of the bladder meridian and its relationship to the kidney and bladder make it a crucial channel for the flow of energy in the body. A harmonious flow of qi in the bladder meridian is of great importance for maintaining a healthy energy balance and general well-being. Connection to other meridians. The bladder meridian in traditional Chinese medicine TCM is closely connected to other meridians and forms a complex network that regulates the flow of energy in the body. The connections to other meridians are an essential aspect for diagnosis and treatment in TCM. Here are some important connections of the bladder meridian to other meridians. Kidney meridian. The bladder meridian is closely connected to the kidney meridian as both are classified as yin meridians and belong to the zhang, yin, organs. Kidney energy plays a central role in TCM and the bladder meridian supports its functions. A harmonious cooperation between the bladder meridian and the kidney meridian is crucial for maintaining vital energy and life fire in the body. Small intestine meridian. The small intestine meridian is the yang partner of the bladder meridian, as it belongs to the fu organs, yang organs. The relationship between the small intestine and bladder meridian is part of the concept of yin and yang, which plays a central role in TCM. A harmonious flow of qi in the small intestine meridian supports the function of the bladder meridian and vice versa. Triple warmer meridian. The triple warmer meridian is another meridian that is connected to the bladder meridian. The triple warmer is a complex concept in TCM and encompasses 3 energetic areas in the body. It influences the flow of energy along the back of the body and is therefore connected to the bladder meridian, which also runs along the back. Large intestine meridian. The large intestine meridian is the partner meridian of the lung meridian and is also indirectly connected to the bladder meridian. Harmonizing the large intestine meridian can have a positive effect on the flow of energy throughout the body, including the bladder meridian. These connections between the bladder meridian and other meridians show the complexity and interplay of the energetic system in TCM. A holistic view of the connections and interactions of the meridians is crucial for the diagnosis and the development of an effective treatment strategy. By specifically influencing one or more meridians, the energy flow can be regulated and the energetic balance in the body can be restored. Functions and properties of the bladder meridian. The bladder meridian in traditional Chinese medicine TCM has a variety of functions and properties that are closely related to the energy flow and well-being of the body. The bladder meridian regulates the flow of qi, vital energy, along its course and supports the function of the bladder and kidneys. It is part of the yin meridian system and is closely connected to the kidney meridian, which is also one of the yin meridians. There are several acupuncture points along the bladder meridian that are used by TCM practitioners to regulate the flow of energy in the meridian and restore the energetic balance in the body. Treating these points can release blockages or stagnations in the meridian and allow the qi to flow freely again. The bladder meridian runs along the back of the body and is therefore particularly important for supporting the back and neck muscles. Disturbances or disharmonies in the bladder meridian can lead to complaints such as back pain, stiff neck and headaches. The bladder meridian is also closely linked to the concept of yin and yang. As a yin meridian, it is related to the zhang organs, especially the kidney, while the small intestine meridian plays a role as a yang partner. A harmonious flow of qi in the bladder meridian is of great importance for maintaining a healthy energy balance and general well-being. Through targeted treatment of the bladder meridian, the energetic balance in the body can be restored and health promoted. Overall, the bladder meridian plays a crucial role in TCM and is closely linked to the health of the entire body and mind. Its functions and properties make it an important part of the energetic system in TCM and help maintain a harmonious flow of energy in the body. Main functions of the bladder meridian. The bladder meridian in traditional Chinese medicine TCM has several main functions that are closely related to the energy flow and health of the body. Regulation of energy flow. The bladder meridian regulates the flow of qi, life energy, along its course. A harmonious energy flow is crucial for maintaining health and well-being. Supporting bladder function. The bladder meridian has a close connection to the bladder and supports its function. Optimal bladder function is important for the elimination of waste products and toxins from the body. Support of kidney function. The bladder meridian is closely related to the kidney meridian, which is one of the yin meridians. In TCM, the kidney is a central organ for storing essence and regulating vital energy. The bladder meridian supports the function of the kidney and thus contributes to maintaining vitality and the life fire in the body. Influence on the back and neck. The course of the bladder meridian along the back of the body makes it particularly important for supporting the back and neck muscles. Disturbances or blockages in the bladder meridian can lead to complaints such as back pain, stiff neck and headaches. Regulation of yin and yang. The bladder meridian is closely linked to the concept of yin and yang as the yin meridian. It works closely with the small intestine meridian, which is considered the yang meridian. Harmonizing the two meridians plays a role in maintaining the energetic balance in the body. Physical and energetic properties of the meridian. The bladder meridian has both physical and energetic properties that make it unique. Physical characteristics. The bladder meridian runs along the back of the body, starting at the inner corner of the eye and extending over the head, neck, back and buttocks down to the heels and soles of the feet. There are 67 acupuncture points along its course, which are used by therapists in TCM to regulate the flow of energy in the meridian and to release blockages. Disturbances or disharmonies in the bladder meridian can lead to physical complaints such as back pain, stiff neck, headaches and problems in the bladder and urinary tract. Energetic properties. As a yin meridian, the bladder meridian is connected to the zhang organs, especially the kidney, which is responsible for storing essence and regulating vital energy. The bladder meridian plays a role in regulating the flow of energy in the body and supports the harmonious cooperation of yin and yang. A harmonious flow of qi in the bladder meridian is of great importance for maintaining a healthy energy balance and general well-being. The physical and energetic properties of the bladder meridian make it an important part of the energetic system in TCM. Targeted treatment of this meridian can help regulate the flow of energy in the body and promote health and well-being. Relationships with the organs and body systems. The bladder meridian in traditional Chinese medicine TCM is closely related to various organs and body systems. These relationships are an important aspect to understand the functions and importance of the bladder meridian for the health of the body. Here are some of the relationships of the bladder meridian to the organs and body systems. Bladder. The most obvious connection is between the bladder meridian and the bladder itself. The bladder meridian plays an important role in regulating bladder function and can be used for disorders such as cystitis or urinary tract problems. Kidney. The bladder meridian has a close connection to the kidney as it is a yin meridian and belongs to the zhang organs. The kidney is a central organ in TCM, responsible for storing essence and regulating vital energy. The bladder meridian supports the function of the kidney and helps maintain vitality and life fire in the body. Back and neck. Due to its course along the back of the body, the bladder meridian is particularly important for supporting the back and neck muscles. Disturbances or blockages in the bladder meridian can lead to complaints such as back pain, stiff neck and tension. Nervous system. The bladder meridian runs along the spine, which contains the spinal cord, which is part of the central nervous system. A harmonious flow of energy in the bladder meridian can help support the nervous system and promote communication between the brain and the body. Muscles and connective tissue. The bladder meridian also influences the muscles and connective tissue along its course. Targeted treatment of acupuncture points along the meridian can relieve tension and improve blood circulation in the muscles and connective tissue. Urinary tract and reproductive organs. Since the bladder meridian runs through the pelvis, it can also influence the function of the urinary tract and reproductive organs. Harmonious regulation of the bladder meridian can have a positive effect on the health of these organ systems. The relationships of the bladder meridian to the organs and body systems show its complex role in TCM. A harmonious flow of energy in the bladder meridian is of great importance for maintaining a healthy energy balance and the well-being of the entire body. Targeted treatment of the bladder meridian can help to support the functions of the associated organs and body systems and promote health. Diagnostic methods related to the bladder meridian. In traditional Chinese medicine TCM, there are various diagnostic methods to assess the condition of the bladder meridian and identify possible disorders or imbalances. Analysis and interview. The TCM therapist begins with a detailed analysis and interview of the patient. Information is collected about the symptoms, medical history, lifestyle, eating habits and emotional state. A detailed analysis can provide important clues about possible problems related to the bladder meridian. Inspection. The therapist performs a careful inspection to detect external signs of possible imbalances in the bladder meridian. These include, among others, skin changes, color and moisture of the tongue, and the condition of the pulse quality. Palpation. By palpating certain acupuncture points along the bladder meridian, the therapist can detect blockages, hardening or other irregularities in the energy flow. Palpation of the acupuncture points provides information about the condition of the bladder meridian and other meridians connected to it. Diagnosis of the tongue. Assessing the tongue is an important diagnostic method in TCM. The color, shape, moisture and texture of the tongue can indicate possible disorders in the bladder meridian and other meridians. Diagnosis of the pulse. Pulse diagnosis is a special technique in which the therapist feels the patient's pulse at different points on the wrists. The quality of the pulse can provide information about the condition of the bladder meridian and other organ systems. Relationship to other meridians. The therapist also looks at the relationship of the bladder meridian to other meridians and the general flow of energy in the body. A holistic diagnosis takes into account the interactions between the meridians and enables a comprehensive treatment strategy. The diagnostic methods relating to the bladder meridian are based on the holistic view of body and mind in TCM. By combining various diagnostic techniques, the therapist can assess the condition of the bladder meridian and other energy pathways in order to develop an individual and targeted treatment and restore the energetic balance in the body. Assessment of the bladder meridian in TCM diagnosis. The assessment of the bladder meridian in TCM diagnosis involves a holistic consideration of various aspects. These include the analysis and questioning of the patient, the inspection of external signs, the palpation of acupuncture points along the meridian and the diagnosis of the tongue and pulse. The interactions of the bladder meridian with other meridians are also taken into account in order to obtain a comprehensive picture of the energetic state of the body. The diagnosis aims to identify possible blockages, stagnations or imbalances in the bladder meridian and to develop a targeted treatment to regulate the energy flow in the meridian and restore the energetic balance in the body. Pulse and tongue diagnosis in connection with the bladder meridian. Pulse and tongue diagnosis are important techniques in TCM for assessing the condition of the bladder meridian. During pulse diagnosis, the therapist feels the patient's pulse at various points on the wrists. The quality of the pulse can provide information about the condition of the bladder meridian and other organ systems. Tongue diagnosis involves assessing the color, shape, moisture and texture of the tongue. The tongue can provide clues to possible disorders in the bladder meridian and other meridians. The combination of pulse and tongue diagnosis enables an accurate assessment of the energy flow in the bladder meridian and an individual treatment strategy. Typical disturbance patterns and their interpretation. Typical disturbance patterns in the bladder meridian can be blockages, stagnations or disharmony in the energy flow. A blockage in the bladder meridian can cause back pain, stiff neck and headaches. Stagnations in the meridian can lead to problems in the bladder and urinary tract, such as cystitis or urinary tract infections. Disharmony in the bladder meridian can also affect the nervous system and lead to emotional problems such as anxiety or nervousness. The interpretation of these disturbance patterns allows the therapist to specifically treat acupuncture points along the bladder meridian in order to regulate the flow of energy and restore the energetic balance in the body. The TCM diagnosis aims to identify the causes of the disturbances and develop an individual treatment strategy to promote the health of the bladder meridian and the entire body. Disorders and imbalances of the bladder meridian. Disturbances and imbalances of the bladder meridian in traditional Chinese medicine (TCM) can lead to various physical and emotional complaints. Blockages or stagnations in the energy flow of the bladder meridian can cause back and neck pain, headaches, sciatica and problems in the bladder and urinary tract. Emotional imbalances such as anxiety, nervousness and emotional instability can also indicate disharmony in the bladder meridian. Targeted treatment using acupuncture, moxibustion, acupressure or herbal medicine aims to regulate the energy flow in the bladder meridian and restore the energetic balance in the body to promote health and well-being. Common diseases and complaints related to the meridian. Common conditions and ailments associated with the bladder meridian include back pain, neck tension, sciatica and headaches, which can occur along the course of the meridian. Bladder and urinary tract problems such as cystitis and urinary tract infections are also common conditions associated with the bladder meridian. Causes of disturbances and imbalances. Disturbances and imbalances in the bladder meridian can be caused by various factors. These include physical overload, lack of exercise, poor posture, excessive emotional strain, stress and poor lifestyle habits such as poor diet or lack of sleep. External factors such as cold or damp can also affect the flow of energy in the bladder meridian. Influence of emotions on the bladder meridian. The bladder meridian is closely linked to emotions and can be affected by emotional stress. Emotional imbalances such as anxiety, nervousness, frustration and emotional blockages can disrupt the flow of energy in the bladder meridian and lead to physical complaints. Conversely, a physical disturbance in the bladder meridian can also have emotional effects, as the meridians are considered in TCM to be part of a complex energetic system in which body and mind are interconnected. Treatment of the bladder meridian therefore aims not only to alleviate physical symptoms, but also to restore emotional balance and promote health holistically. Treatment methods for the bladder meridian includes various methods to regulate the energy flow in the meridian and restore the energetic balance in the body. Common treatment methods include acupuncture, by inserting fine needles at specific acupuncture points along the bladder meridian. The flow of energy can be regulated and blockages can be released. Acupuncture can relieve both physical and emotional discomfort and improve general well-being. Moxibustion. Moxa, a dried mugwort herb, is heated near acupuncture points along the bladder meridian to strengthen energy and release blockages. Moxibustion is often used in combination with acupuncture. Acupressure. In acupressure, the acupuncture points are stimulated with finger pressure in order to harmonize the energy flow in the bladder meridian and relieve discomfort. Herbal medicine. Taking specially selected herbs can support the flow of energy in the bladder meridian and promote health. Herbs are often administered in the form of teas, capsules or granules. 2. In a massage. This special form of massage focuses on stimulating acupuncture points and meridians, including the bladder meridian. 2. In a massage helps to release tension, regulate energy flow and relieve discomfort. The treatment methods for the bladder meridian aim to release blockages or stagnations in the energy flow, support the function of the bladder and kidneys and restore the energetic balance in the body. An individual and holistic treatment strategy is developed to take into account the specific needs of the patient and achieve the optimal result. Acupuncture and moxibustion. Acupuncture is a traditional TCM treatment method that involves inserting fine needles into specific acupuncture points along the bladder meridian and other meridians. This regulates energy flow and releases blockages to relieve discomfort and restore energetic balance. Moxibustion complements acupuncture by heating dried mugwort herb near the acupuncture points to strengthen energy and release blockages. Herbal medicine and nutritional therapy. Herbal medicine is another pillar of TCM and involves the use of specially selected herbs to support the flow of energy in the bladder meridian and promote health. The herbs are often taken in the form of teas, capsules or granules. Nutritional therapy aims to adjust the diet according to the patient's individual needs in order to strengthen the bladder meridian and other meridians and achieve a healthy energy balance. Qigong and Tai Chi to harmonize the meridian. Qigong and Tai Chi are movement exercises based on Chinese philosophy and TCM. Through gentle, flowing movements and conscious breathing, the flow of energy in the bladder meridian and other meridians is harmonized and strengthened. These practices promote general well-being, reduce stress and support the health of body and mind. Self-care and prevention for the bladder meridian. Self-care and prevention for the bladder meridian include a conscious lifestyle that aims to support the flow of energy in the meridian and prevent possible disturbances. These include regular exercise. Through regular exercise such as yoga, Tai Chi or Qigong, the energy flow in the bladder meridian can be harmonized and strengthened. Good posture. Good posture, especially when sitting and standing, relieves pressure on the bladder meridian and promotes a smooth flow of energy. Sufficient rest and sleep. Sufficient rest and sleep support the regeneration and strengthening of the bladder meridian. Stress management. Stress can affect the flow of energy in the bladder meridian. Relaxation techniques such as meditation, breathing exercises and massage can help reduce stress and strengthen the meridian. Adapted diet. A balanced diet tailored to individual needs can support the bladder meridian and other meridians. Keep warm. Especially in cold and humid environments, it is important to keep the bladder meridian warm to avoid blockages. Through conscious self-care and prevention, the bladder meridian can be strengthened and the energetic balance in the body can be maintained, which can lead to better health and increased well-being. Exercises and techniques to strengthen the meridian. Exercises and techniques to strengthen the bladder meridian include movement practices such as yoga, Tai Chi and Qigong, which harmonize and strengthen the flow of energy in the meridian. These exercises promote good posture, support the muscles along the meridian and improve blood circulation. Acupressure can also be used by gently stimulating certain points along the bladder meridian to regulate energy and release blockages. Everyday practices to prevent disorders. Daily practices to prevent bladder meridian disorders include wearing appropriate clothing, especially in cold and humid environments, to keep the meridian warm and avoid stagnation. Regular exercise and a balanced diet support the health of the bladder meridian and other meridians. Stress management and relaxation techniques are also important to support the flow of energy in the meridian. Recommendations for a healthy lifestyle. A healthy lifestyle helps strengthen the bladder meridian and overall energy balance. This includes getting enough rest and sleep, a balanced diet, regular exercise, stress reduction and relaxation techniques such as meditation or breathing exercises. Wearing appropriate clothing and keeping the body warm in cold and damp environments are also part of a healthy lifestyle. Conscious self-care and a holistic approach to health support the prevention of disorders in the bladder meridian and promote the well-being of body and mind. Bladder meridian and modern medicine. Scientific research and studies on the bladder meridian. Scientific research and studies on the bladder meridian in traditional Chinese medicine (TCM) are limited, but there is increasing interest and effort to investigate the understanding and effectiveness of TCM principles. Some studies have focused on acupuncture and moxibustion related to the bladder meridian and examined their effect on specific ailments such as back pain and urinary tract infections. Although the results are promising, further research is needed to better understand the mechanisms and effectiveness of bladder meridian treatment methods from a scientific perspective. Integration of TCM principles into modern healthcare. In some countries, the integration of TCM principles into modern healthcare is becoming more common. Acupuncture and herbal medicine are increasingly accepted as complementary therapy options alongside conventional medical treatment. In some cases, clinical studies have shown that combining TCM with modern medicine can produce positive results for certain conditions. The integration of TCM principles into modern healthcare opens up new possibilities for holistic approaches to health promotion and treatment. Critical review and possible synergies. Criticism of TCM, including the bladder meridian, often lies in the limited scientific evidence and the difficulty of explaining the meridians with the anatomical structures of the body in modern medicine. Some aspects of TCM could be considered esoteric because they are based on a different understanding of the body and energy than Western medicine. Nevertheless, possible synergies between TCM and modern medicine cannot be ignored. Viewing the body as a holistic system and considering environmental factors, nutrition, emotions and lifestyle in TCM could be important aspects that can be integrated into modern healthcare. Some studies have already shown that combining TCM principles with modern medical approaches can be effective in certain cases and opens up new treatment options and perspectives. The critical consideration and possible synergies between TCM and modern medicine require further research and open discussions in order to utilize the best of both worlds and enrich healthcare. Case studies and experience reports. Case studies and testimonials provide personal insights into the application of TCM principles, including the bladder meridian, in the treatment of specific health conditions. These reports describe patients' individual experiences and provide insight into the effectiveness and benefits of TCM from the perspective of those affected. Example 1. Ms. X, 38 years old, suffered from recurrent bladder infections and urinary tract problems. Conventional medical treatment only brought temporary relief. Following a recommendation, she consulted a TCM therapist. Acupuncture and herbal medicine strengthened the bladder meridian and removed blockages. Ms. X reported a noticeable improvement in her symptoms and a reduction in the frequency and severity of her bladder problems. Example 2. Mr. Y, 45 years old, suffered from chronic back pain and neck tension. Conventional physical therapy provided only limited relief. After visiting a TCM clinic, he received acupuncture and moxibustion along the bladder meridian. Mr. Y noticed a significant improvement in his back pain and neck tension, which he attributed to the TCM treatment. Testimonials provide insight into the individual stories of people who have integrated TCM principles, including the bladder meridian, into their healthcare. These reports can include both positive and critical experiences and show how TCM can work as a complementary or alternative therapy option. It is important to note that case studies and testimonials are individual and do not serve as scientific proof of the effectiveness of TCM. Nevertheless, they provide valuable information and insights into how TCM can be applied in practice and the impact it can have on people's well-being and health. Testimonials from patients with bladder meridian problems. Testimonials from patients with bladder meridian problems offer personal insights into the effectiveness of TCM treatment. People who suffered from complaints such as recurrent bladder infections, urinary tract problems, back pain or neck tension report on their experiences with TCM therapy. These reports describe how treating the bladder meridian improved their symptoms, how their well-being changed, and how TCM helped them achieve a better quality of life. Before and after comparisons after treatments. Before and after comparisons are another tool for demonstrating the effects of TCM treatment on the bladder meridian. Using images, measurements or other objective parameters, the conditions before TCM treatment and after therapy are compared. This makes it possible to document and illustrate positive changes, improvements in symptoms and possible successes in the treatment. Therapeutic approaches based on case studies. Therapeutic approaches based on case studies show how TCM therapists tailor the treatment of the bladder meridian to different patients. Detailed case studies describe how the diagnosis is made, which treatment methods are used, and how the therapy restores the flow of energy in the bladder meridian. These case studies provide insights into the holistic approach of TCM and show how individual complaints, lifestyle and emotional factors are incorporated into the treatment. The patient testimonials, before and after comparisons and therapeutic approaches are valuable tools to illustrate the effectiveness and benefits of TCM treatment of the bladder meridian. They provide practical examples and insights into how TCM is applied in practice and how it can help treat health problems and promote well-being. It is important to note that these reports are individual and do not serve as scientific evidence, but as complementary information and experience from practice. Summary of key findings. Traditional Chinese medicine TCM considers the bladder meridian to be an important energy pathway in the body, connected to the bladder and kidneys. The bladder meridian runs along the back and affects various physical and emotional functions. TCM principles, including acupuncture, moxibustion, herbal medicine and qigong, are used to regulate the flow of energy in the bladder meridian to treat disorders and imbalances. TCM diagnostic methods allow for an individualized and holistic approach to assess the condition of the bladder meridian and other meridians. Outlook on future developments in the field of meridian research. Research on meridian science and TCM in general is becoming increasingly important. Future developments may include scientific study of acupuncture points and meridians, research into the mechanisms of TCM treatment, and integration of TCM principles into modern healthcare. Further studies could further investigate the effectiveness and safety of TCM treatment for various health conditions, including bladder meridian problems, and expand the understanding of TCM principles. Closing words. The bladder meridian plays an important role in traditional Chinese medicine and influences various aspects of the body and mind. TCM principles offer a holistic approach to health and can be a complementary or alternative therapy option to modern medicine. Testimonials and case studies demonstrate the individual effectiveness of TCM treatment of the bladder meridian and other meridians. Future research and development in meridian research promises to further promote the understanding and acceptance of TCM in modern healthcare. It is important to explore the synergies between TCM and modern medicine and to use the best treatment approaches for people's well-being and health. Which Bach flowers are important for the bladder meridian? Bach flowers are an alternative therapy method that can be used to support emotional balance. They were developed by Dr. Edward Bach and are available with 38 different flower essences. Each Bach flower is associated with certain emotional states and is intended to help balance them. With regard to the bladder meridian in traditional Chinese medicine TCM, there are no specific Bach flower remedies that are directly related to this meridian. The Bach flower remedies are used more generally for harmonizing the emotional level of the body and can therefore also be helpful for emotional states that are influenced by disturbances in the bladder meridian. Some Bach flower remedies that can be used for stress, anxiety or emotional tension could potentially be helpful in supporting the bladder meridian, as emotional imbalances are often associated with physical disorders. Bach flower remedies that can be used for emotional stress include, for example, Star of Bethlehem, for shock and trauma, Mimulus, for specific fears, Aspen for vague fears, and Rock Rose, for extreme anxiety. It is important to note that the use of Bach flowers is an individual decision and it is recommended to consult a qualified Bach flower therapist or other health professional to determine the most appropriate Bach flowers for personal emotional needs. The Bach flowers should be used as a complement to a holistic treatment and not as a substitute for medical advice or treatment. Bach flowers. Star of Bethlehem is one of the 38 Bach flower essences developed by Dr. Edward Bach. This flower essence is associated with the state of shock, trauma and emotional pain. The Star of Bethlehem essence is often recommended when someone has had a traumatic experience, whether physical, emotional or mental. This could be sudden bad news, an accident, the loss of a loved one or any other harrowing experience. People suffering from shock or trauma may feel emotionally numb or dazed, may have nightmares or trouble sleeping and may have difficulty coping with the situation. The Star of Bethlehem flower essence is used to help deal with such emotional stress and to promote the process of healing and emotional comfort. By releasing emotional blockages, the essence can help overcome shock and support emotional healing. The essence is said to be helpful not only in acute states of shock, but also in processing past traumas. It is important to stress that the use of Bach flower remedies is a personal decision and has no scientifically proven effect. The Bach flower remedies are intended to support emotional balance and should not be considered a substitute for medical treatment or professional advice in the event of serious traumatic events. It is recommended to consult a qualified Bach flower therapist or health professional to determine the most suitable flower essence for individual needs. Mimulus. For specific fears. Mimulus is another Bach flower essence developed by Dr. Edward Bach. This flower essence is associated with the state of specific fears. Mimulus is recommended when someone suffers from specific, clearly defined fears and worries. These fears can relate to everyday situations, certain animals, social interactions, health problems or other concrete aspects of life. People who need Mimulus can often name and describe their fears, but they still feel affected by them and can have difficulty coping with them. The Mimulus essence is used to help overcome these specific fears and to promote confidence and inner strength to deal with the challenges. The essence can help to alleviate fears, increase self-confidence and provide a feeling of security. It is intended to help people to deal with the stressful situations that trigger their fears more courageously and calmly. It is important to stress that the use of Bach flower remedies is a personal choice and has no scientifically proven effect. Bach flower remedies are intended to support emotional balance and should not be considered a substitute for medical treatment or professional advice for serious anxieties. It is recommended to consult a qualified Bach flower therapist or health professional to determine the most suitable flower essence for individual needs. Aspen for vague fears. Aspen is another Bach flower essence developed by Dr. Edward Bach. This flower essence is associated with the condition of vague anxieties and fears of unknown or intangible threats. Aspen is recommended when someone suffers from diffuse fears without being able to say exactly what they are afraid of. These fears can manifest themselves as general unease, nervousness or a vague feeling of restlessness. People who need Aspen often have the feeling that something threatening could happen, but without being able to say exactly what it is. The Aspen essence is used to help overcome these vague fears and to promote confidence and inner strength to deal with uncertainty. The essence can help to alleviate fears, strengthen the feeling of security and provide a feeling of safety. It is said to help people feel braver and more relaxed, even if they cannot name any specific reasons for their fears. It is important to stress that the use of Bach flowers is a personal decision and has no scientifically proven effect. The Bach flowers serve as support for emotional balance and should not be considered a substitute for medical treatment or professional advice for serious anxieties. It is recommended to consult a qualified Bach flower therapist or a health professional to determine the most suitable flower essence for individual needs. Rock Rose. For extreme anxiety. Rock Rose is another Bach flower essence developed by Dr. Edward Bach. This flower essence is associated with the condition of extreme anxiety and panic attacks. Rock Rose is recommended when someone is suffering from acute, overwhelming anxiety accompanied by panic, fear and a feeling of total helplessness. People who need Rock Rose may find themselves in a situation where they feel extremely threatened or are facing a life-threatening crisis. These anxiety attacks may also occur after traumatic events or may suddenly appear for no apparent reason. The Rock Rose essence is used to help manage these extreme states of anxiety and to alleviate the feeling of being overwhelmed and helpless. The essence can help to restore inner balance, reduce panic and provide a feeling of inner strength and calm. It is said to help people to deal with challenging and frightening situations more courageously and fearlessly. It is important to stress that the use of Bach flower remedies is a personal choice and has no scientifically proven effect. Bach flower remedies are intended to support emotional balance and should not be considered a substitute for medical treatment or professional advice for severe anxiety. It is recommended to consult a qualified Bach flower therapist or health professional to determine the most appropriate flower essence for individual needs. Rights and ownership notice. This audiobook is published and distributed by Testbericht-Institut LLC. All copyrights, publishing rights, distribution rights, audio rights, and related intellectual property rights for this work have been lawfully and exclusively acquired by Testbericht-Institut LLC. Testbericht-Institut LLC is the sole and unrestricted rights holder of this audiobook, including the right to reproduce, distribute, publish, monetize, and publicly perform the content on digital platforms such as YouTube. The original manuscript files, source documents, and contractual acquisition records serve as proof of lawful ownership. The original author and/or their authorized representative, Renovatio LLC, has transferred all relevant rights to Testbericht-Institut LLC in accordance with applicable copyright and publishing law. This ownership applies to all current and future uses of this work, including audio, video, and digital publications. Effective date of rights ownership: the 1st of February 2026. Any unauthorized use, reproduction, re-upload, redistribution, or claiming of this content is strictly prohibited. Copyright Testbericht-Institut LLC. All rights reserved.